So my name is Dr. Minda, and I'm going to discuss the spatial. So these spatial senses, as we all know, we have olfaction, which is smell, gustation, which is taste, hearing, equilibrium, and vision. So those are the five spatial senses. So the receptors for taste are in the taste buds, and the taste buds are in the papillae of the tongue. Yeah, and these receptors for taste are chemoreceptors, so they're able to detect chemicals in the solution in the mouth. So you need to go through your gross anatomy of the tongue. Remember, it's a mobile and muscular organ in the oral cavity extending to the oropharynx, and it helps in chewing and taste, swallowing, articulation of words, and oral cleansing. So the tongue has a root, it has a body, and an apex or the tip. Then the one surface on top is the dorsum, and the one at the bottom, the smooth one part, is the ventral surface. So the dorsal surface has a V-shaped groove, which is this terminal sulcus. It's V-shaped. And this terminal sulcus now divides the dorsum of the tongue into anterior 2/3, which is oral, and posterior third, which is the pharyngeal part. So what's the epithelial lining of the tongue? Stratified squamous, keratinized on the oral part, and non-keratinized on the undersurface. So this is the V-shaped groove that divides into anterior 2/3 and posterior third, okay, which is in the oropharynx. And then these are the papillae. So we have different papillae that make the dorsum of the tongue rough. So you have the valid papillae that form a V around this V-shaped groove. Then you have foliate, filiform, and fingiform papillae. So we have those four types of papillae. So the papillae are just elevation on the oral epithelium, and the filiform papillae contain no taste buds, while the fungiform, which are mushroom-like, they have scattered taste buds. Foliate also contain many taste buds. Then we have circumvallate papillae that are 7 to 12, and they are large and circular. They are distributed anterior to the portion of the tongue. So these are the valate papillae, and they're anterior to the terminal sulcus. Again, these are the papillae, and it's within the papillae that you have the taste buds, and this is the structure of the taste buds. So you have the taste pore here. This is the stratified lining, keratinized squamous epithelium. So you have taste pore. This is where the taste chemical substance will be perceived. Then it enters the taste bud, and the taste bud usually has three cells. It has the gustatory cells, which are the receptors that connect to the nerve. Then you have the support cells, and which are also called sustentacular cells, and stem cells, which are the basal cells that help in regeneration. So those are the three types of cells. So basal cells for regeneration, support cells for sustentacular cells that support the gustatory cells, and the gustatory cells are the receptors that respond to the chemicals. Then we have what we call gustatory hairs. These are like microvilli, yeah? They protrude through the taste pore. Therefore, they're usually stimulated. After stimulation, they're able to depolarize, and that's how impulses are generated and transmitted through the cranial nerves to the brain. So the gustatory cells are usually replaced 7 to 10 days by the basal cells. So the basal cells are stem cells. So the taste buds have what you call von Ebner's glands. These produce serous fluids, and these serous fluids are able to wash off the substance that you're testing. So yes, you can test something, but a few minutes later you no longer feel the taste because the von Ebners have been able to wash it off from the taste bud. So if you bring a new substance, the tongue will be able to perceive it as something new. So the taste buds are onion shaped. They contain 50 to 100 cells. They usually lay on a basal lamina, and the apical part has microvilli that are within the taste pore. Okay, so we have different types of sensation of taste. So you have saltiness, sourness from the side, sweetness, and bitterness, as well as umami. So we have different muscles of the tongue. This is sort of gross anatomy. The muscle has extrinsic muscles. The tongue has extrinsic muscles that come from the bones around. So genioglossus from the genu of the mandible to the tongue, hyoglossus from the hyoid, styloglossus from the styloid, and palatoglossus from the palate. Then they originate outside the tongue, and their main function of extrinsic muscles is to move the tongue. But we also have intrinsic muscles. superior and inferior longitudinal, transverse muscles, and vertical muscles. And these, they are within the tongue. They don't originate from outside. Their main function is to alter the shape. Motor innervation to muscles of the tongue is by 12th cranial nerve, hypoglossal. So all muscles of the tongue are innervated by hypoglossal nerve except palatoglossus, which is innervated by the pharyngeal plexus. The tongue receives blood supply from lingual artery that comes from external carotid artery and is drained by the dorsal lingual vein. So you can appreciate the lingual arteries and veins coming to the tongue. What's a sensory innervation of the tongue? This is based on the embryonic origin. So the anterior two-thirds, remember the tongue is able to sense taste, which is spatial sensation, but it also is also able to face pain and temperature, that's general sensation. So anterior two-thirds of the tongue, spatial sensation is by chorda tympani of facial, but general sensation is by lingual from mandibular of trigeminal. Posterior third, both spatial and general sensation are from glossopharyngeal. Then the root of the tongue, both spatial and general are from vagus. Okay, so it's only anterior two-thirds that's different. Taste is by chorda tympani of facial, and pain and temperature is by lingual from mandibular of trigeminal. Then lymphatic drainage of the tongue. So you have the root goes to deep cervical lymph nodes. On the sides, they drain into submandibular nodes, then the tip into submental lymph nodes, but the center of the tongue drains on the opposite sides into the inferior deep cervical node. So the root is in the superior deep cervical lymph node, the center on the inferior deep cervical lymph node, the sides on submandibular lymph nodes, and the tip is by submental lymph node. So when you ask lymphatic drainage of the tongue, you should be able to draw, and it easily helps you to, portray that. So this is just a congenital anomaly where you have a tongue tie, so the tongue is attached to the tip of the tongue is attached on the floor of the mouth by the frenulum. Usually when a child is born with such, you just, cut the frenulum and release the tongue. Then another clinical application, you have various veins under the tongue. So you can actually put some drugs. Some drugs are administered sublingually for quick absorption. A good example are the nitroglycerin. These are for people who are having angina pectoris, which is, depletion of blood supply to the heart. So they get pain. So you can quickly give nitroglycerin to dilate the vessels of the heart. So you give them sublingually because the absorption is very quick due to these vascular structures. Then we have what you call gag reflex. When you put something into the mouth and you go and touch the roof of the mouth at the deeper portion, what happens? The person will gag. Why? Because you carry the sensation by glossopharyngeal nerve, and that goes quickly to the brainstem and communicates with the same glossopharyngeal and vagus that innervate muscles of the pharynx, leading to contraction. So that gagging is because the pharyngeal plexus formed by 9, 10 nerves will cause contraction of muscles of the pharynx. Then we go to the next sensation, which is smell. So the nose, there's an external nose and the nasal cavity. The nasal cavity is divided into right and left by the nasal septum, and we have chemoreceptors for smell in the nose, and they are able to detect chemicals in the air that you breathe, and these chemoreceptors are actually in the upper or the roof of the nasal cavity. So the external nose, on the inner part of the external nose of the nares, you have sebaceous and sweat glands, and you have what you call vibrissae that are able to filter out large particles from the inspired air. Then what about the skeleton of the nose? The nose is made up of bone and hyaline cartilage. So the bones, we have nasal bones, the frontal processes of the maxilla, the nasal part of the frontal bone and its nasal spine, and lastly, the nasal septum, which is made up of voma of the ethmoid. But remember, the nasal septum anteriorly is also made up of hyaline cartilage. So it's made up of perpendicular plate of ethmoid and the voma, as well as hyaline cartilage. So that's just to show you the nares, the apex, the root, that's those some of the nose, and these are the bones. So nasal bone here, okay. Then you have the frontal bone, maxilla, so they all contribute. So the nasal cavity, on the lateral aspect, it has concha, superior, middle, and inferior. They're like shelves Okay, and these shells are covered by respiratory epithelium, which is pseudostratified columnar ciliated with goblet cells. So the superior conchae and the roof of the nasal cavity has specialized olfactory epithelium, which we're going to discuss. So this is the olfactory epithelium at the roof. That's where sensation of smell occurs. This is the vestibule with stratified squamous epithelium. These are the conchae. Okay, so the shells which help to condition the air. So they contain blood vessels, they're able to warm the air before the air is inspired. So what are the boundaries of the nasal cavity? The roof is formed by frontonasal, ethmoid, and the floor is formed by palatine process of maxilla and horizontal plates of palatine bone. Then at the center, the two cavities of the nose are separated by nasal septum, which is made up of hyaline cartilage anteriorly and bone posteriorly, that is perpendicular plate of ethmoid and the vomer. Then the lateral wall of the nasal cavity is made up of superior, middle, and inferior conchae. So how do you perceive smell? So you have the olfactory mucosa at the roof of the nasal cavity, that's at the superior concha, and it's lined by pseudostratified columna. Okay, then we have three types of cells and a gland. What are these cells? We have the support cells or the sustentacular cells, basal cells, and olfactory cells. So the support cells are broad with cylindrical apices, but their bases are narrow, and their surfaces have microvilli, and the olfactory are bipolar neurons. So you have two projections of cilia that will help to increase the surface area so that you're able to increase surface area for perception. Those are the three types of cells in the olfactory epithelium: sustentacular support cells, basal and olfactory cells, which are the receptor cell. Here we have Bowman's gland. So they also produce serous fluid, and this serous fluid is able to dissolve odoriferous substances. So for example, if you smell perfume and immediately afterwards, the Bowman's glands produce serous fluids that dissolve that odoriferous substance. So immediately, if I bring coffee, you'll be able to smell coffee. Okay. Then, so these are the olfactory cells. These are the support cells, the sustentacular cells. These are the basal cells. Okay, and these are the Bowman's gland producing serous substances to come to the surface, and they dissolve the odoriferous substances here. And you can see the olfactory cells, they have sort of the microvilli on their surfaces. So we have many olfactory cells, and sniffing just intensifies the sense of smell. And they have cilia on the surface, and the chemicals stimulate the cilia or the filaments and carry that information to the nerve. So these are the cilia that are stimulated by the chemicals in the air you breathe. Then it should be carried by the olfactory receptors through the filaments and the nerves into the brain. Okay, so you're able to perceive that smell. When it gets to the brain, you're able to adapt, you're able to memorize that this is perfume, this is this is that. So in the next lecture, we discuss the